Hi, I am Dr. Rashmi, Consultant Nephrologist and Transplant Physicians at Manipal Hospitals Varthur, Bangalore. Today I am here to give you some knowledge about what is urinary tract infections, UTIs as it is commonly called. Infection in any part of your urinary system, right from your kidneys, ureters, the urinary bladder or the urethra is called as urinary tract infections. This occurs most commonly in women, around 10 times most common in women than in men. So why the urinary tract infections occurs more commonly in women, we'll come to that later. But yes, this is a very common problem in women and majority of the women shy away from coming to the doctors. But yes, you should consult your doctors and get yourself treated. So this urinary tract infection can be of two types. It is called as the lower tract UTI when only the urinary bladder and the urethra is involved. When you have some abdominal discomfort or minor burning sensation while passing urine, or even sometimes some blood in the urine, which can be all the symptoms of UTI. Of course, there will be no fever or abdominal pain as such. This is more of a nuisance value, but definitely can be very discomforting for the patient. The second type is the upper tract urinary tract infections, where the kidneys and the ureters are also involved, which can cause hospitalizations plus or minus ICU and definitely can be a cause of mortality in postmenopausal women. So this is definitely very important that you get yourself identified if you have a urinary tract infection and get treated. So what exactly causes this urinary tract infection? It is an infection either by bacteria or fungi, depending upon your immune system. It is an infection of the urinary tract. What all are the risk factors? Who is at risk for this urinary tract infection? Being a lady, that itself is a risk factor. Sexual intercourse, using of birth control pills, or any abnormalities in your urinary tract or in your kidneys, any polycystic kidney diseases, or any recent procedures which you have undergone through your urethra or any other procedures concerning the kidney, then you are definitely at risk for a urinary tract infection. Why is it important to get treated? First of all, lower urinary tract infections, though they do not cause long-term damage, definitely of a lot of abdominal discomfort and nuisance value to the lady, and since it is recurrent, can hamper your daily living. So that is one part of it, the morbidity part of it. But yes, second part is the hospitalization, the need for ICU and mortality. And in the long term, repeated urinary tract infections can cause chronic kidney disease, which is definitely a possibility in postmenopausal women, or recurrent pyelonephritis, like what we call it, the kidney infection. So it is better that you get identified if you have any of these symptoms which I mentioned, to go to your nephrologist and get yourself treated for it. So apart from the treatment what your nephrologist give, like antibiotics or hospital care, what do you have to do? So you have to take plenty of fluids. There are certain medications in the market like cranberry capsules. Though there is not much literature on that, it is advised to take cranberry capsules. There is some literature which says it is effective in some women who have recurrent UTIs. And take plenty of antioxidants, fruits and all this during the episode of UTI. So in case you have any kidney dysfunction associated with the urinary tract infection, definitely your doctors will advise you what diet needs to be taken along with the urinary tract infection treatment. So if you have any of these symptoms, please don't hesitate to contact your nephrologist. We are just a call away or click away at the website. Thank you. Today I'll be talking about kidney disease in women. Are there any specific risk factors that women experience which increases the risk for kidney disease? This is a very important topic which has received quite a bit of attention in the recent past. So in 2018, the World Kidney Day was celebrated, the theme of which was kidney health in women. So approximately around 45% of the world's population are the girl kids and women. So of course they are exposed to a lot of risk factors which the men are exposed also. But there are certain risk factors which are unique to women, which places them at risk for kidney disease. So here I am to tell you a few of the risk factors which can cause kidney disease in women. Hormones protect the women against cardiac disease, but unfortunately kidney disease is not so. They are more at risk. So first factor is pregnancy. It's a very unique situation for women and quite a challenging one. As much as pregnancy is a boon to mankind, it can be a bane in certain women if they develop any kidney disease. So today's surviving and economic lifestyles, what are there? The pregnancy is quite postponed from the 20s to the 30s in today's women. So gestational diabetes and hypertension is quite common in women during their pregnancy, and majority of the times It resolves after pregnancy, but they can develop kidney disease. So in case you have any hypertension during pregnancy or any kidney disease which is detected during pregnancy, please go and consult a nephrologist to me what is to be done about this. In case you had some pre-existing kidney disease, that can also resurface during pregnancy, because pregnancy is a unique situation where the needs of the body are different. You require more blood for you and the kid. So the blood supply will have to be more, which increases the pressure on the kidney, and whatever kidney disease was pre-existing can resurface. So in case you find any differences in your creatinine values, or your gynec tells you that you have some kidney issues, please consult a nephrologist. Next thing is, there are certain multi-system disorders which are more common in women. In fact, 10 times more common in women than in men. Some of the disorders like this are systemic lupus erythematosus and rheumatoid arthritis. Lupus especially can affect women in a large way. In fact, the spectrum of presentation can be a very mild urinary abnormality to end-stage kidney disease requiring dialysis and transplantation. So in case you're diagnosed of any of these diseases like lupus or rheumatoid arthritis, please do get yourself evaluated for any signs of kidney disease. Third thing is urinary tract infections. Definitely the female anatomy itself is a very risky factor for recurrent urinary tract infections. There are two types of urinary tract infections, lower tract infections and the upper tract infections. The lower tract infections generally don't cause much issues, just some abdominal discomfort and burning sensation while passing urine, which is more of nuisance value. But the upper tract infection can definitely lead to a lot of morbidity, including hospitalizations and death as well. So repeated upper tract infections like repeated kidney infections can lead to chronic kidney disease in the long term. So this is a unique situation which can happen in women, and of course more common in postmenopausal women, and especially the situation worsens if you are a diabetic too. Next of these things is malignancies, cancers of the breast and cervix. What we have noticed in our everyday practice is these cancers, which were usually occurring in the 5th or 6th decade, has shifted a decade earlier. We are seeing a lot more younger women being diagnosed with cancer cervix or cancer of the breast. So majority of the health checkups which are advised at the hospitals after 40s, they generally have a screening for cancer breast and cancer of the cervix. They generally do a pap smear or your mammograms to detect any cancers, and these two cancers can affect your kidney as well. So not much of breast cancers, but cancer cervix definitely yes, they can block both your kidneys, lead to kidney failure with requirement of dialysis as well. So depending on the stage of cancer, the involvement of the kidney also can vary. So this is a general bird's eye view of whatever kidney diseases can affect women specifically. Definitely in terms of kidney donors, this is just an add-on. In terms of kidney donors and transplantation, we have seen a lot of women who come forward for donation. So this is just to say that there are a lot of women out there who are very healthy and ready to donate their kidneys to their kith and kin. But yes, on the flip side of it, there are a lot of women, especially in the rural areas, though the scenario is getting better by the day, who are not receiving the required attention either in terms of access to the care for CKD, dialysis or transplantation. However, things seem to be getting better. Like what I said, kidney health in women has received attention in the recent past. So I would hereby request all the women to take care of themselves and get themselves out of this hustle and bustle of their daily lives and take better care of their health. Thank you.
Hi, I'm Dr. Garima Agarwal. I'm a consultant nephrologist and transplant specialist at Manipal Hospital Varthur Road. And today I'm going to talk about aging-related damage to kidneys in women. Now, aging itself is known to cause some amount of kidney function loss, which is normal, but older women, which usually refers to women over the age of 50, have a unique risk factor profile for kidney disease. Not only that, they face challenges in terms of access to healthcare services. When we talk about older women, they are more at risk of kidney diseases due to a variety of diseases such as diabetes. We know that after 5 to 10 years of diabetes, women, men both, can develop kidney damage. Also, high blood pressure is one of the most common causes of kidney damage. Especially postmenopausal women are much higher at risk of developing frequent urinary infections. These frequent urinary infections, if not treated on time, can spread up to the kidneys and can even cause complete kidney failure. Older women have unique challenges in terms of risk for cancers like cancer cervix, which can also directly or indirectly damage the kidneys. Diseases such as renovascular diseases, wherein cholesterol or atherosclerosis deposition in the kidneys blood vessels can cause damage to the kidneys, and a lot of the times older women present with high blood pressure or breathing difficulty or worsening kidney functions, and that may indicate that the blood vessels to the kidneys are blocked. Also, urinary incontinence is common in older women, wherein there is leakage of urine constantly, and that can predispose them to getting urinary infections, which can in turn damage the kidneys. Even chronic kidney disease, which is a state of irreversible damage to the kidneys, is said to be higher or more common in women than men. And some of the reasons for this could be that women earlier on in their life during pregnancies, if they have had complicated pregnancies with hypertension or preeclampsia or leakage of protein in their urine during pregnancies, we know that these women, as they get older, have a higher chance of developing chronic kidney disease. There are also diseases of the body like SLE, rheumatoid arthritis, systemic sclerosis, which are much more common in women than men. And we know that people suffering from these diseases also have a higher chance of developing chronic kidney disease. In fact, it is said that chronic kidney disease is the 8th leading cause of death in women. Other than the risk factor profile, which is quite alarming in older women, there is also the challenge of access of women to medical treatments, dialysis and transplant. Data from our own country shows that even when dialysis is free, it is said that less women go for it than men. Also, data from around the world shows that a woman is more likely to donate a kidney than to receive one. With all of these challenges facing aging women and kidney disease, I urge women to take their health in their own hands, and only then can we ensure healthy families, communities and populations. So if you are a woman over 50, please get your kidney tests done routinely and consult a nephrologist if you have a problem. Thank you.
Hi, this is Dr. Pallavi Patri, Consultant Nephrologist and Transplant Specialist at Manipal Hospital at Sarjapur. This year for Women's Day, I'll be discussing the importance of lifestyle and diet with respect to kidney disease. So chronic kidney disease is as prevalent, if not more so, in women across the globe than it is in men. So it is important for us to know the risk factors associated with the development of kidney problems. So we all know traditional risk factors such as development of high blood pressure, diabetes, and independently obesity as risk factors for chronic kidney disease. And so in women as well as in men, and it is important for us to remember that a well-balanced diet with reduction in carbohydrate intake and regular physical activity and control of your weight are important for reducing your risk of developing diabetes, which then can lead to development of kidney problems, as well as reduction in your weight and your risk for obesity, which in itself can lead to kidney disease. Salt intake, people may not realize, actually increases your risk for development of high blood pressure, which, like I said, can also cause kidney problems. So keeping your salt intake restricted, keeping your portion sizes restricted, regular activity will reduce your risk factors for development of all of these things, as well as what is called polycystic ovarian syndrome in women, which is part of what is called the metabolic syndrome. All of this increases your risk for kidney disease in the future. Women are also more at risk for urinary tract infections. Urinary tract infections, especially when they reach the level of the kidney, can impact kidney function down the line. So drinking plenty of fluids reduces your risk, and appropriate hygiene will reduce your risk of developing urinary tract infections, as well as kidney stones. And women in particular, at the time of pregnancy, can develop certain issues that can lead to kidney problems in their future. So again, issues like control of your diet during your pregnancy, making sure you have a well-balanced diet, making sure that you don't develop conditions such as gestational diabetes or high blood pressure during pregnancy, conditions in severe cases such as preeclampsia and eclampsia during pregnancy, all of which can impact your kidneys in the future, is really important. And again, staying active, watching your weight during your pregnancy, making sure your salt intake is controlled and your carbohydrate intake is controlled during that period of time will reduce the risk of development of those conditions and an impact in the kidneys in the future. So thank you very much. I hope this was informative. Happy Women's Day.
Why a routine checkup for women is important in terms of kidney health? Women often tend to prioritize their family needs and ignore their own health needs. So on this International Women's Day and Kidney Day, I'd like to highlight the importance of women's health, particularly the kidney health. What are the symptoms of kidney disease? Kidney disease in early stages could be totally silent. It is best detected only with a urine test and a blood test. But in later stages, you may have tiredness, you may have lethargy, bony pains, urinary disturbances, anemia. So all these symptoms could be because of an underlying kidney disease. Women can be prone for acute kidney injury during pregnancy because of hypertensive disorders of pregnancy, preeclampsia and so on. So it's very important during pregnancy the woman's blood test and the urine test is detected routinely, and it's often done nowadays. But it is sad to say, unfortunately in poorer countries, sometimes chronic kidney disease is picked up only during pregnancy. So how do we prevent kidney diseases? Chronic kidney disease may not be totally preventable, but we can take some steps to prevent this chronic kidney disease by leading a very healthy life, exercising well, managing your stress, managing your diabetes, blood sugars and high BP. One should also maintain healthy weight because it's also seen that obesity can lead to kidney problems, and avoid smoking. Also important to avoid unnecessary medications which are not given by the doctor, especially painkillers. Painkillers sometimes can be very harmful to the kidney. Whether you have a kidney disease is to have yourself tested. That is a simple urine test and a blood test. Worthwhile getting tested because kidney diseases have treatment if they are detected early. Historically, dialysis patients have had poor pregnancy outcomes, but it's a lot better these days because of better dialysis therapy, treatment of anemia and good neonatal care. High frequency dialysis improves pregnancy outcomes. However, it's always advantageous for women with end-stage kidney disease to have renal transplantation and then plan for pregnancy. Pregnancy in the dialysis patients may not be very favorable because one may have maternal complications and fetal complications. It's always better for a patient with end-stage kidney disease to plan for pregnancy after transplantation because pregnancy outcomes are better with transplantation, and one can have a normal healthy baby, usually best planned after 1 to 2 years after having a transplant.